So as we've discussed in class and through email, acute and chronic inflammation can often happen at the same time. And this is a great example of a case in which that happened. So this was an autopsy that we did last year. And this is a section of the lung. And you can see that you have some vessels, and these are the alveolar spaces. And within the alveolar spaces, you'll notice these big foamy cells. These are all macrophages. And so macrophages are part of the chronic inflammatory response that come in to clean up the damage, as we spoke earlier. Now, of course, this doesn't look all that impressive, just some chronic inflammation, but right to the south from that, you can see our old friend, acute inflammation and necrosis. And so here you have a bunch of fibrin and blood, as we saw in the esophagus biopsy, and scattered neutrophils. So this person had an acute infection in addition to having one that had been going on for a while. And what this case actually turned out to be was a case of Cmv Pneumonitis. And we know that because we can actually see the viral inclusions within some of the infected cells. And so this is actually a CMV inclusion. We know it's CMV because it is both nuclear and cytoplasmic. So you can see purple dots in the cytoplasm and a large glassy nuclear inclusion there next to that large blood vessel. Interestingly, we have another cellular accumulation. Here we have hemosiderin, and you can tell because it's a brown granular pigment. We do often see that in the lung, especially in older patients that have congestive heart failure. So this is an example of acute and chronic inflammation with necrosis secondary to CMV pneumonitis.